Good afternoon, Ji. I am Dr. Jaskaran Singh, Neuro and Spine Consultant at Manipal Hospital Patiala. Today, I would like to discuss a case, a very young person, 21-year-old male patient, who came to us with history of road traffic accident with severe injuries, polytrauma. He had multiple injuries at that time, and this accident occurred on 13th of August last year. The patient had multiple injuries, which included head injury, cervical spine injury, chest injuries, and patient was very badly injured with very few chances of survival. Today, I would just want to show this patient to you so that we can bust all the myths regarding cervical spine injury. When people say that with cervical spine injury, a patient never walks again, or patient commonly सुनते हैं कि patient के हाथ पैर सारे खड़ जाते हैं. So I just want to show you one of the patients who had very severe spine injury and who was paralyzed before the surgery, and he was operated 1 year back, and today he came to my OPD for follow-up after 1 year. So this patient was he met with an accident, unfortunately, and was brought to us in a critical condition. Patient was put up on a ventilator and he was managed in the ICU initially. All the investigations were done and he was found to have head injury, which was severe. He was unconscious initially. He had cervical spine injury, that is, there was C5 vertebra, cervical spine 5th vertebra was fractured and it had gone back. There was retrolisthesis grade 4 of cervical spine vertebra, of 5th cervical spine vertebra, and for this, patient was initially managed in the ICU with cervical traction. Then later on, when patient's condition stabilized a bit, he was operated after 4 to 5 days, and he underwent a long surgery which lasted around 5-6 hours. The patient's C5 vertebral body, that is a part of the vertebra, was removed in the surgery and it was replaced with the bone graft from his hip. That is called an iliac bone graft. So we removed C5 vertebra, that is, we did a C5 corpectomy and placed an iliac crest vertebral graft instead of that vertebra to realign the vertebra and to realign the spinal column. You can see that in the post-op x-rays, the post-op alignment was fantastic, and we got a post-op MRI also done when the patient recovered. So that showed that there was no compression of the cord, the cervical spine cord, after surgery. So this patient slowly was weaned off the ventilator. He did undergo tracheostomy initially and it was removed after 2.5 months. Patient regained his power with by God's grace and with rigorous physiotherapy. The patient and his family put in tremendous effort, and he was able to regain his power. His hands and lower limbs started moving and he started getting more and more power in them. And post-op patient, when he came to me for follow-up after 1 year, the patient now is able to walk on his own. His power is completely recovered, although he has some stiffness of all the 4 limbs, but otherwise there is no major neurological deficit. As you can see in the picture, the patient is able to raise his hands, he is able to walk properly, he is able to stand and sit properly by himself, and he's leading a very good life right now. And this is all just thanks to his family's efforts and by God's grace that the patient has recovered so well. Thank you.